Hello everyone, this is Chad Dolan, Washington County Fair Rabbit Superintendent. And today I'm going to discuss rabbit diseases and health problems, including symptoms and treatments. Now keep in mind, I'm not a veterinarian, so it's best if you don't understand exactly what disease your rabbit might have or how to treat it, that you consult with a rabbit savvy veterinarian. That being said, here we go. One of the first diseases I'll discuss is ringworm. Its symptoms are hair loss in patches, dry flaky skin, large flakes in fact, and scratching. The typical treatment is to shave the hair in the infected area and treat with athlete's foot cream. Just a warning, this can be spread to humans. The prognosis is good to excellent. The next disease I'll discuss is wryneck. The symptoms include the head tilting to one side of the body. This can be pretty shocking if you walk out to your rabbitry and you see this happening. The treatment includes using injectable terramycin as ear ointment. Place drops in both ears for 15 to 17 days. And the treatment of this particular disease is more effective if you treat it as soon as possible. The prognosis is fair to poor. Eye infections are a more common problem you might see in your rabbitry. The symptoms include the eyes of rabbits or kits, that is baby rabbits, sticking shut. There may be pus or a sticky discharge. The treatment includes terramycin ophthalmic ointment applied twice per day at the base of the eyelids for 5 to 7 days. The prognosis is excellent to good. Another common problem is weepy eye or conjunctivitis. Symptoms include excessive tearing where the fluid runs down the cheek. You might see hair loss, redness, and irritation, especially around the eyes and eyelids. The treatment includes washing the eyes with a sterile solution. Terramycin ophthalmic ointment may help also. Remove the source of the irritant, whether it be dust, spray, fumes, or possibly you just have a bacterial infection. The prognosis is excellent with early aggressive treatment. The next health issue is gastrointestinal stasis. The symptoms include small and/or malformed fecal pellets. You can see an example of those in the picture at the bottom of the page. There might be no fecal pellets, a loss of appetite, lethargy, and/or hunched posture. The treatment includes motility drugs, IV fluids, pain medication to alleviate discomfort due to gas buildup, syringe feeding of critical care, a supplement, and possibly antibiotics, but they've got to be used with extreme caution. The prognosis, honestly, is quite poor. Next, we have abscesses and tumors. Symptoms include fibrous tumors and lumps and bumps and protrusions caused by insects, infections, or possibly cancer. Treatment may require surgical removal or draining, followed by treatment with topical antibiotics. The prognosis is good to poor. You might also see sore hocks. This is a common problem in larger rabbit breeds such as Rex. Symptoms include redness and swelling in the rear feet, as well as pressure sores. The treatment would be to provide cage floor mats or a soft bedding material to allow your rabbit to lay down. Keep the cage clean, and you can also apply hemorrhoid cream and antibiotic ointment separately or in combination to the wounds. You may need to bandage the wounds temporarily, but change those dressings often. The prognosis, as long as you have early and consistent treatment, is excellent. Our next health issue is vent disease or spirochetosis. Symptoms include blisters, scabs, or a crust that forms on the genitals and around the mouth or nose. It has a cauliflower appearance. This disease is transmitted from rabbit to rabbit through breeding. The treatment includes penicillin injections. Do not breed your rabbit until all lesions are gone. With consistent treatment, the prognosis is excellent. Our next health problem is worms. Symptoms include sudden weight loss, trouble maintaining weight, a poor coat condition, scratching, or irritation around the back end. Treatment includes a dewormer such as Quintrex, which is a liquid, or Safeguard, which is pellets. Administer your dosage dependent upon rabbit weight. The prognosis with treatment is excellent to good. Now, your rabbit might also develop or have dental issues. Now, healthy rabbit teeth look like those in the picture at the top of the slide. But you might also observe chipped or broken teeth or malocclusion, also known as wolf's teeth or buck teeth. Now, treatment can include trimming the teeth and ensuring your rabbit can wear down their teeth by providing hay or hard chewables. Worst case scenario, it might be a genetic issue, and that may involve selective culling, removing rabbits that are carrying the genetic code for bad teeth from your herd. Now, the prognosis obviously can be excellent to poor. The next issue you might observe is ear mites. The symptoms include scabs in the ear, and they might be small scabs at first that develop into a thick, flaky crust. There may be head shaking and scratching. Treatment includes using a cotton swab to apply mineral, vegetable, or olive oil all over the visible crust. You might also need to inject or apply an antiparasitic medication. If treated properly, the prognosis is excellent. Now, a common problem you might see in rabbits is heat stress, especially during hot summers. Now, signs of heat stroke in rabbits include drooling, reddening of ears, taking short, quick breaths, acting very sleepy, lethargic, or moving slowly, falling unconscious, and in the worst case scenario, convulsing. Now, it's pretty easy to cool down rabbits and turn them in a positive direction by moving them into a cool, shady area out of the sun. Use a cool, wet towel to dampen their fur or wrap around their ears to help them get cool. Put them near a fan and let them drink small amounts of cool water. Another trick we use in the summertime is to freeze bottles of ice and stick those bottles in the cage. The rabbit can lean against the bottle and cool itself down. So definitely be aware of heat stress. The next disease you might observe is coccidiosis. It's a disease that primarily affects young rabbits. It causes diarrhea, poor condition, a pot belly, loss of appetite, and rough coat fur. If you could look at the liver, it may be white spotted, enlarged, and there may be small hemorrhages. Now, the treatment includes sulfaquinoxaline in feed or drinking water continuously for 2 weeks. If treated early and aggressively, the prognosis is excellent. At some point, you may see enteritis. The symptoms include a watery diarrhea, and this may be the only symptom. Treatment includes cleaning your rabbit, encouraging lots of hay consumption, and considering that your rabbits may have coccidiosis and that you may need to treat for this disease. Consider providing a medicated or vitamin-fortified feed. For adult rabbits, the prognosis is good. Enteritis may be more of a problem for young rabbits. You may observe snuffles or pasteurellosis. Symptoms include a nasal discharge, watery eyes, head shaking, sneezing, a rattling noise in breathing, weight loss, and in bad cases, sterility. Now, the treatment is tetracycline in feed for uncomplicated cases, but for accurate treatment, the organism needs to be cultured and identified. The prognosis is good for control, but poor for a cure. You might also observe hutch burn. Symptoms include a brownish colored scabbing and potentially a bloody weep. Treatment includes cleaning the area with a germicidal soap and keeping the area clean. As a preventative, ensure the hutches are very, very clean. The prognosis, if treated aggressively, is excellent. And finally, this brings us to RHD, or rabbit hemorrhagic disease, which is a virus. Symptoms include loss of appetite, lethargy, high fever, seizures, jaundice, bleeding from the nose, mouth, or rectum, difficulty breathing, and in a lot of cases, sudden death. As far as treatment, there really isn't any treatment. Euthanization is recommended due to excessive suffering. A vaccination exists, but is not readily available. Efforts at prevention are key. The prognosis for a rabbit that contracts RHD is grave. Again, I would reinforce that RHD is a disease that is not to be taken lightly. You should educate yourself on RHD biosecurity measures. You can find a lot of this information on the American Rabbit Breeders Association website. Refer to that information, learn about it, and learn how to prevent RHD from ever infecting your rabbitry. Currently, rabbit hemorrhagic disease has not been found in the state of Iowa. It is mainly prominent in the southwestern United States, although cases have been identified in Montana and in Florida. Now, again, this is not to be taken lightly. There are restrictions in Iowa against people bringing rabbits from the areas that are RHD positive to our state. Obviously, if RHD gets into our state, this could impact our ability to show rabbits at the Washington County Fair or American Rabbit Breeders Association rabbit shows. So be very mindful of RHD and learn about it. Hello again, this is Chad Dolan, Washington County Fair Rabbit Superintendent. And I just wanted to jump in here one more time and say always consult with the veterinarian for disease confirmation and dosage levels. I am not a veterinarian, and this presentation was really meant just to give you an idea of what sort of diseases you might observe and basic treatment options, but nothing beats consulting with a rabbit savvy veterinarian. So for more information, see the American Rabbit Breeders Association Raising Better Rabbits in Cavies book. You can buy this book on their website, or you can obtain it by becoming a member of the American Rabbit Breeders Association. If you have any more questions, feel free to contact me at the phone number or email listed on this slide. And in the meantime, enjoy raising rabbits.